All right, welcome to Froning and Friends, our second episode with Dr. Sean Goddard or Dr. Christopher Goddard, or what was the other name?
I have Joseph too.
Joseph Goddard. So it goes by Sean mostly, right? That's what you said? Okay. Yeah. Cool. So yeah, we last time we talked all about stem cells, and that was a couple weeks. I'm 2 weeks out from my third treatment. Knee feels great right now. We did 225 wall balls today and ran. Did a bunch of double unders yesterday, so knee feels great. So we're trending in the right direction.
So you notice a difference from even that the second treatment.
Yeah.
Okay.
Yeah, I feel. I mean, I'd say 90% better, 92% at this point.
I think one exercise you're still having an issue with was those Olympic
lifting. Just the bottom of the squat. You know, the catching at the bottom.
Is that still there?
I haven't done a ton of that yet.
Okay.
I've been doing a lot of power type stuff just because I'm going to try to ease back into that stuff and see if we can just kind of build up from there. So, but I feel great right now.
Okay.
It's been good. Been running a lot more, squatting a lot more.
Awesome.
Did thrusters. I have 90 thrusters or 90-something thrusters and 18.5. So.
He doesn't say no when we're like, hey, do you want to squat today?
Yeah.
No longer says that.
And before he
I'd be like, no, I'm good.
Not really.
What about,
not feeling so good today.
What about inflammation?
Inflammation's down. I'm not having any. There's no inhibiting inflammation. You know, there's still a little bit of surface inflammation. It looks like definitely on the outside or on the lateral side. But I'm not having that just real tightness in the back of the knee when I squat. So that's nice. That is a very pleasant experience.
That's much better.
Much better. So yeah, like I said, we just did a little interval style workout with some peg boards, 200 meters of running, and wall balls. So usually the running and the squatting mixed together would just trash my knees. And so actually both of them are feeling good, which we injected into the other one, the tendonitis in the other one. So
any pain with that right one?
A little bit, but not. I mean, it's like before it was like a 7 or 8 when I would be running. Now it's like a 2.
Okay,
I can deal with the 2.
And that one, like I told you, had to be so specific. It was right at that patella. But that's good.
Yeah, we're getting there.
Very good.
Yeah,
awesome.
Heck yeah, I feel.
How do you feel like that sleeve? Because we don't talk a lot about it. But do you feel what kind of effect
we should probably explain it first. So it's like it's a knee sleeve that has kind of these pads that one is on the medial side of the quad, the VMO, and then one's kind of on the not mid hamstring, but a little bit higher up on the hamstring, and it almost like puts pressure there to activate the quad and the hamstring to work together, I guess. And it seems to help. Like if I'll start to notice if I haven't worn it in a couple of days, I'll put it back on if I'm going to walk around a lot, and it's just activating the muscles, I think, correctly, and kind of taking some of the pressure off the kney. And so it's definitely helped.
Is that a sleeve that you got from him?
Yeah, the ones that I've been wearing.
What's
obviously,
the design?
I didn't make it. It's called TA. Of course, right now. I think it's
SEP or something.
TA25.
Yeah, something like that. The company's CEP.
The company Accelerate. So the main company's TA25 or 125. Then I know Accelerated Biologics, and he's kind of been with me through my whole PRP experience. 10 years ago, really, basically. And then he's grown with me and I've grown with him as he's gone to different companies. And I've learned a lot about PRP. And so he loves these new little startups. Yeah. And so he finds these people and thinks, things will be good. And we talk about it. And this was one of them. And I found a lot of people have been doing well with it. But, small companies, they don't have the big money like, some of these other bracing companies and things. And it's simple,
it's real simple.
You just put on. But the biggest issue I think we found was staying on your legs. So he's working with the owner of the company
to put it into a compression short, because the problem is with my quad, it just kind of slides down.
So is it like a muscle activation tool? It's pressure
and just pressure. Yeah. So it puts pressure on the right muscles to make them activate in the proper way.
I've seen you wearing it. I just didn't know it was.
Yeah.
And it looks simple, right?
Yeah.
It's so simple, but very powerful. Very powerful for the knee. And it is made for sports, but it's also made for post-surgery. Wow. Is kind of the biggest thing, because what people don't really understand about and why people still think steroid shots are okay, whatever. You get compensation patterns that happen from an injury. So the body's trying to protect. Mm-hmm. So when we can actually regrow tissue, then it can let those muscles relax.
Right.
But that they've been so compensated for so long that you need help to undo that. That's where therapy and things like this come into play.
Right.
To refire the muscles in the right way as we're regrowing tissue.
So do you wear it during workouts, or is it more of like the downtime between?
Really kind of depends on what the workout is. If there's a ton of running, just because right now it slides down and moves so much that I don't like. Today I was wearing it when we did the first workout, and then when we were doing the running and the wall balls, I was just like, I'm not going to be messing with this thing the whole time. So I didn't wear it. I wore my knee sleeves.
But you can wear it. Like, it's good to wear it while you're working out for the activation aspect of it.
But I just figure the more I walk around with it, the more the muscles will get activated, and maybe I won't need it as much while I'm working out. So.
And that is the goal, like 20 to 30 minutes a couple times a day is the idea, to train your muscles to do that. Then eventually
it just does it. And that for, I think, like 2 or 3 weeks, I wore it every day, all day, every day. And it seemed to really help, and so now I'm just every once in a while I'll be like, I haven't worn that in a while. He's not hurting, but I can kind of tell, so I'll put it on, and it seems to. So
it will eventually retrain it to the point that you don't need to wear it anymore. Is that the idea?
That's the goal. Yep. Okay. So I kind of look at it in 3 levels, right? We got to regrow tissue with the injections. Then we need therapy to help get rid of compensation and help start training. But this is something you can do every day, which is what we're, it's kind of what we miss in a lot of our therapy, because we try to go twice a week, which, okay, that's nice, but every day you're putting bad pressure on your joints. So definitely trying to get that back. So I think it's worked well. I've had a lot of guys use it, and of course, you've used a lot of stuff over the years, I'm sure.
Yeah.
So
I like it just because it's it's not really inhibiting anything. You can put it on. I've worn it with jeans a couple times. Like, we'd go out and I just put it on underneath, and you can't really tell.
Right.
And it.
Just getting proper activation through your jeans, Why not?
So what should he be expecting in the next month then, based on...
So last time we talked, we had just done the 3rd set of injections, and the biggest issues were those squats and then some of the activity, for endurance. And really, so I had to modify my treatment a little bit, because I felt like it was coming from more of the the calf attachments in the back of the knee. So instead of just sticking with what I saw before, it's just, being a little flexible with what I see, feeling the tissue, and being able to inject in those other areas. And that, I expect to see this pain all go away, and you to do any activity.
That'd be great. We're pretty much there. I mean, we're close. Super close, so I'm very pleased with where we're at, for sure.
You going to be okay to go turkey hunting? That's what I want to know.
That's what matters. Saturday. That's what matters.
Gosh.
That's all I care about.
Do you have like a countdown at your house, like on the wall somewhere?
Like 5 hours or 5 days, 20 or 16 hours. No, we're almost there. I'll just be out at midnight, starting Friday night, just like waiting.
There are all these stories of people who go turkey hunting with him, and he doesn't sit in a blind and wait. He chases turkeys all over the mountains, and so there are stories of people trying to hang. And I was kind of thinking maybe if he's limping, I'll be all right. Maybe.
Yeah, right. Other than that, you don't have a prayer. It's not like he's fit or something. All of a sudden, he's over 7 logs, and you're like, I'm gonna die here. It's fine.
Actually, the guy that I learned turkey hunting from, one of the most unassuming. You look at him; he's older guy. Probably, I don't know how Charles is, but he's an older gentleman, and you're like,
how old is he?
Jim Silver needs to
honestly,
know.
I don't know how old, to be honest. He's
65,
a little older than you.
70.
He's a little older than you. He's not 70.
Is he 50s or 60s or 70s?
I don't know how Charles is. Anyway.
Make me feel good here, will you please?
He's 72.
All right.
No, Charles. But you look at him, and I know he's fit because he does some CrossFit stuff, and he'll just kill himself on whatever he does. But the first time we went out there, and I'm trying to keep up with him, this dude can move through the woods. And I'm like, what the heck? And so I remember the first time I took Hewitt with us with Charles, I was like, Hewitt, just be ready because we're going to move through the woods. And so we take off through the woods, and it's like 90 degrees anyway. And so we're walking through the woods about 10 minutes, and I look at Hewitt, and he goes, holy shit. And I was like, yeah, I told you. Because it was Charles was moving. So pretty cool. But yeah, that's how I learned. So I can't sit still. So I just go out and try to find him. That's just what works.
Yeah, that's as important as CrossFit in my mind.
Yeah.
Have you ever been hunting?
I went twice with one of my buddies in college, and I just didn't know enough about it.
What were you hunting for?
I don't even remember, a certain type of birds.
Oh, okay. Certain type of birds.
Yeah. As long as you didn't say like lizards or something.
Oddly enough, my younger sister is the hunter in the family.
Oh, really?
Out of all of us. Yeah.
Nice.
So, and it's actually somewhere out here. We have some family. They have 140 acres that are ridiculous, and she goes out there. The first time she shot her deer, she was crying.
Yeah. Usually happens. It happens.
But then she goes and skins it herself, does all of it herself.
Wow.
You know?
That's awesome.
That's incredible.
It's
Gotta
pretty.
be able to take care of yourself.
Yeah, she's gung ho.
That's great.
Kind of going back to the knee, though, like even a lot of what I expect is because of how well you've done. Anytime there's a surgical knee or surgical anywhere, we never know if it'll get 100% again,
Right.
Because we're missing tissue, and so it does make it more difficult. But I tell you, this kind of work, though, I've seen a lot of people with severe injuries do well.
Cool.
And kind of like what I told you at the beginning, I felt pretty good about it, but there's always that little bit. Hey,
Right.
Are we going to get there? But
Right.
the fact that you did so well, so quickly, I was like,
That's
man,
good.
You're gonna make it.
Cool.
So
But when you see like bone on bone and you're saying like tissue will regrow, like how substantial is that regrowth?
well, you bring up a good point. What does bone on bone mean, right?
Yeah.
So in our world, we'll be like, okay, you're bone on bone. That's what 5 of your doctors have told you, right? We're like, well, move that knee, and people move it. We're
Yeah.
like, well, if you were bone on bone, that knee wouldn't move. And I've only seen one person like that, and that's a person. I did end up having to send them to surgery, but most of the time it's still there. They're just basing it off an X-ray. It looks like it's bone on bone, but there has to be a little bit of cartilage there, right?
Right.
And so if we can just get those cells in there while there's some cartilage, then we can start to regrow it. So
his
that's a
bone
key.
on bone did not mean.
There's some abrasions on there where there's some missing tissue. Basically.
Well, and they did take, I read the report. They did take cartilage out, so you definitely have some bone exposed.
Right, but not-
you have enough cartilage. You had enough that I was confident that we could actually
regrow
help
or
it.
Help it.
Yeah.
Yeah, and with stem cells, they're not entirely sure what it does to cartilage. The real help is on ligaments and tendons. Am I correct there?
I would say, yeah, we have more studies
right.
with the tendons and ligaments.
Right.
We have seen cartilage regrow.
Okay.
But, what we still don't understand is how many treatments. Why does it, in one person, it takes one treatment, and somebody else it takes 10 treatments? And this is our big issue. But also dosing matters, too. If we use a smaller dose, for financial reasons, or if the doc hasn't done it a lot, then it's kind of like, okay, we'll get some result, but we're not getting as good of a result as we could have. And so there's lots of ifs and ands out there right now with this stuff, and really it's based on experience. And that's why I tell anybody, if you're not going to see me, just ask around. Say, hey, how often do you do this? Let me talk to some people you treat, and that way you're confident in what they do. Because if they're like, oh, we're going to do steroid shots first, in my opinion, I'm always a fix the tissue first, then do all this other stuff.
Right.
If you don't have that kind of attitude, in my mind, it's okay. Maybe.
So that's a flag. If they suggest steroid shots first, be like, I'm going to shop around a little bit.
That's my opinion, because it's a philosophy, really. And my philosophy is the body's always trying to heal itself, and we can actually make it heal itself.
Right.
But we just got to stimulate with the right thing. So if you're willing to go one route first, because the studies have shown that the steroid shots actually decrease cartilage, and
Right.
you can hurt yourself more by
Yeah.
thinking you're okay.
I'm like, no, don't give me no more. I don't want any more cortisone.
That's what I've done. That's all I've done.
Yeah, well, because I mean that before
Yeah.
before I went and met with you guys, one of the guys here was like, yeah, if it doesn't get any better, none of the inflammation goes out, we'll just give you the cortisone shot. And I was like, nah, that's not the route I want to go. I want to see if we can figure out something else first. And I'm glad we made that decision for sure.
Yeah, and I've only done 2 steroid shots in the last 8 years.
Wow. That's a
And-
good number.
And really it's because somebody had to do something the next day.
Yeah.
And I couldn't say, now that I've done a lot more of it, I'm still kind of like, maybe if we did this stem cell, maybe people would get better. But I just don't have that guarantee.
Yeah.
I've seen too much variability in how long it takes somebody to recover. So I'm like, okay, we'll do it so we can get you working out, for a couple days. And then when you're free, we can come back and do this.
Do that.
But,
How does the stem cell affect the arthritis in the knee?
so arthritis is destruction of the cartilage. So that's where it comes into that you hear bone on bone, different things
Right.
like that. So then we just want to inject and regrow that cartilage. We don't have hardcore proof that it does,
Right.
but I've seen a lot of functionality studies or just functionality case studies for my my practice, where people are able to go, instead of walking a quarter of a mile, they're hiking 10 miles.
Oh.
So I've seen some really, really great things. Do we know for sure? Is it regrowing the cartilage, decreasing the inflammation, it's probably a combination of a lot of things.
Right.
And we're still in that research phase, is trying to find out exactly what it is. And that, that's where you get more in the kind of university and research setting versus the private practice, right? Because, we want to get people better now, and we may not understand the science of it right now, but we know that we're seeing people better, stronger, and in your case, like decreasing inflammation, all this stuff. And it's like, why wouldn't we be doing this as long as the safety's there?
Right.
And right now, we haven't had any problems, unless it was just done in certain areas of the body that were a little too aggressive. There were a couple cases with the eyes that people did get blinded. It wasn't from the cell itself. It was more of a fluid effect, a mass effect. So it pushed on the nerves, and that's how it happened. So, but other than that, the safety's really good with this stuff.
It's exciting to see it grow. Imagine what it's going to be like in a couple of years if it, starts to gain traction, because the proof is in the results,
Just a few years ago, I've gone to these stem cell conferences now for many, many years. And every year, so many more doctors are in there. And so one day this will be the future of medicine and rural medicine.
Right.
It's just, we got to just refine our little things right now and figure out, because even from the stem cell aspect to the chemical, we're actually stimulate chemicals to talk to the cells, and they're breaking this stuff down. And I'm like, man, you all are way smarter than me.
That's awesome.
I know how and where to inject it, but you all know how it's working.
That's really neat. Well, so we talked about last time when the cameras were off, a little bit about the other testing that you do, and talking to a group of people who care about their bodies and athletes. 1% makes a difference. And you were talking about these tests that you do. And I mean, it sounded really cool. And I was wondering if you could talk a little more about that, because I think there are a lot of athletes that would love this kind of testing. Macros are huge right now. One step further of actually knowing deficiencies in your body and things that you might need to be putting in. I feel like that's really valuable as well.
100%. What got me into this aspect of it, as a segue, I was treating an 80-year-old lady with grade 4 arthritis in her shoulder. She had surgery the year before, couldn't even lift her arm, and she's like, I just want to pick up my grandkid. Oh. And so I was like, okay, we're going to do 3 sets of treatments, and we did it. 100% better. And even today, she's like 80% better even today. And that was 5 to 6 years ago that we injected her.
That's awesome.
But I had a 20-year-old MRI, completely normal, and she could barely lift her arm. And I treated her 6 times, and she wasn't getting better. And then I was just thinking, okay, what's going on?
Something's not right.
Yeah, so that's what made me think something in the body's not right. Toxins, nutrient deficiencies, even stress. I don't get too much into that mind-body aspect of it. I leave it to other people. But I do believe that has a big factor too. But then it got me into the testing, and it got me really wanting to learn more. So I ended up getting involved with the American Academy of Anti-Aging, where we learn about hormones, we learn about toxins in the body, metabolic testing. I got into an organization called ACAM, so American College for the Advancement of Medicine, where they get you certified with chelation therapy, which is actually looking at metals in the body. And if metals get in the body, it can disrupt hormone function. It can get caught in the heart, get caught in the brain, and can just disrupt healing.
Does that include aluminum?
Yep.
I just heard the other day,
deodorant.
Oh, I knew the deodorant thing, but
wow.
So much aluminum.
Someone was talking about how if you wrap your food in aluminum foil and you use aluminum foil on the grill, which I always do to alleviate cleaning, and I'm crazy about that stuff.
Cause.
I just threw all my aluminum foil in the trash literally 2 days ago.
Miss Healthy, gotta have
You're
organic
killing
and
yourself,
everything.
Ellie.
You're
Do
killing
you
all
cook
of
with
us.
aluminum foil?
No,
You're
I
right.
don't. I don't grill with aluminum foil.
Well,
my dad does, and I'm like, I just don't like the flavor of it.
Well, I've been poisoning you with
You can
baked
really
goods
taste
wrapped
it.
in aluminum.
That's
Yeah,
interesting.
I don't know. I just like the open fire. I don't know.
Yep.
It's kind of messy.
Well, yeah, and that's a great point, and that gets into what actually leaks out, right? Even plastic bottles. I don't know if you saw the study. I can't say study. It was in the news the other day.
Yeah.
About everything just leaking into the water.
The micro
plastic particles we're putting in our body, and that actually kind of goes into, we can't test for everything, right? But what do we need to do to get stuff out of our body? So
what is the biggest flag that you see in if you can generalize? That might be too hard to generalize, but if someone comes in, are there any things that you often see very off, or anything that is a contributed from an environmental factor? What's the biggest thing you see when you're reviewing I don't know. I know there's a couple different tests, but one of these.
I would say the gut, if I had to narrow it down to that. The reason I do like to do the testing is because I don't think we can always tell just by talking to people, okay, is it a toxin in your body? Are you nutrient deficient? Or do you have gut issues? And that's why I like to do this testing. And, the test we're looking at right in front of us right now is called the Genova NutriVal test. And I do like it. It gives us a breakdown of many, many things. But on this test, there's 3 main things I look at, which is gut issues. So it shows us dysbiosis for bacteria or fungal. And then we have toxin and detox markers on this. So I like that aspect because maybe we don't know the toxin, but we see that marker go up. And so we know we need to get it out. And then oxidative stress markers are on this. So we have some urinary oxidative stress markers, which show us that the body's breaking itself down, as well as glutathione, which is the number 1 antioxidant in the body. Most people don't know that. They think vitamin C, but glutathione is even more. It's in every single mitochondria, helps to get rid of many different toxins of your body. And then CoQ10 is part of that too. And in this test, you also see we look at the Krebs cycle or citric acid cycle. This is how our body utilizes oxygen right here. So that's why we need to breathe. But it starts with the food we eat, fats, carbs, and proteins. And, as you can see with fats, the thing in green here is what a nutrient is needed to break down a fat. That's why people take L-carnitine, because if you're low in it, you're not going to break down your fat. But that's why it doesn't work in everybody. Some people's levels are fine. And so you can take all the carnitine you want, but it's not going to work on your fat.
But that's found in meat, correct?
Carnitine
can be found in,
Actually, to be honest, I don't know that. I would have to look that one up. I don't know everything.
Of course. Well,
I'll be honest on that.
That was what I had. I was discussing the other day because we have a vegetarian on our team, which is great. Like, totally support that. That's whatever makes you happy. And but what I was listening to is a doctor was discussing that carnitine is found in red meat, and it helps.
Foods, pork, seafood, chicken, but at much lower levels. Red meat is
amino
where
acid you need to use fat as a fuel source. And this doctor, he's a vegetarian, but he said any athlete that comes to me, I actually say I would support you eating red meat if that's ethically okay with you, because looking at other markers, they were finding that it was inhibiting performance in his opinion. So I just didn't know.
Well, it's very interesting, and what I don't really support one diet or another, because I had so many different people coming in. They were vegans, vegetarians. They were on the paleo diets. They were
all messed up.
They were on the lard diets.
Lard diets.
I've seen everything, and everybody has problems, and I've seen everybody get better. And so that's why I'm much more of, let's just look at numbers and try to figure out if we can see something in your body that we need to replace.
Right. I think that's so individual. When people show up and what's going on in their body is different than everybody else. And so I like breaking it down at this level so you really know.
Exactly. And this, I know the page, we nobody can see it right here, but I like to show this page for a couple reasons, because it does show how the foods actually break down to this cycle. But it also shows the nutrients. Like in green, these are nutrients that you need to go from one step to the next. And how if you're deficient in these nutrients, then you're going to have problems. And the things in red are actually metals. So, it's nice that you show me I have aluminum in me or mercury, but why does it matter?
Yeah.
Well, it blocks the pathways, and this is how you produce energy right here. And I find a lot of people, particularly, I look at my really chronic and really ill people, cancer and other things, they have a lot of issues with metals that are blocking these pathways and nutrients that aren't there. And my philosophy is, if we can get the toxins out, metals out, we put nutrients in, we make your body function at a higher level. I'm not trying to fix your body. I want your body to function at its own level, because genetics does play a role. And I just think at some point there can be so many tests that we can overwhelm ourselves. And, I've tried to cut it down to some tests that I think if I can get your gut working, get toxins out of your body, boost your immune system, I feel like you're going to be able to perform at a very high level at that point.
Do you see are people generally missing nutrients, or is it more the toxins? I know that it's probably, you need to have the medium, but what's a bigger problem in people?
So the way I think about it is, if the gut's not working right, it doesn't matter what you eat, you're not going to absorb it, right? So we got to get the gut working right. Then your body can get those nutrients back in. And if toxins are in the body messing up the hormonal system, messing up your gut, then you're not going to absorb the nutrients either. So I think it's more of a gut issue and toxin issue, because usually we're taking, how many of your friends and everybody's taking a lot of supplements, right?
Yeah.
And doing a lot of things. But what if you have fungal overload? What if you have bacteria that aren't quite right in your stomach? So then we're not absorbing these things, which is why I love to get in the IV therapies. For one, not many people do it, and they don't really know it on a molecular level. I've taken many, many courses over it. A lot of people kind of jump into it. Oh, let's put some nutrients in. But I want to do the IVs to fix your gut, to actually get the toxins out. And that way, in the future, you can just do some oral supplementation instead of always coming in for the IVs.
What kind of things are in the IVs again that help in that?
So we have just basic nutrients. My most basic ones: vitamin C, B complex, which has B1, B2, B3, B5, B6, have B12, have magnesium, have calcium, bicarb, selenium, which is extremely important for the thyroid and is an antioxidant. What else? Zinc. In some cases, we can even go, with arginine and NAD. I don't know if you've heard of it. A lot of people take it as a supplement to try to give themselves energy. We can do it IV.
You would know this if you ever came to Knoxville with us.
I did.
Well, she came once. I guess,
she did come once.
Yeah.
You already
Never
forgot.
mind. Yeah, I did.
Jeez. Well, I
You
mean,
didn't come when he was there.
Yeah, I wasn't there. I didn't get a taste.
I didn't know that. They lied. I thought you were going to be there. I thought I was going to be able to ask questions. It's fine.
Oh,
It was a tease.
You were lucky.
we ditched her.
Well, but back to like the B12 and everything. I just recently read something too about how valuable B12 is in athletes and important and all. I mean, of course, but things like that being so important.
Well, then you have B12. There's cyanocobalamin. Cobalamin's B12, but the compound that makes it is cyano or methylcobalamin or hydroxycobalamin. And so cyano's the one in integrated medicine we like the least because it breaks off a cyano group, and you actually have a cyano ion, which can kind of roam around in your body and do whatever things that aren't necessarily positive. The methyl and the hydroxy actually get it into your cell better and actually can make you have higher absorption. Wow. And when it breaks off, the methyl breaks off or the hydroxy breaks off, it can be used in a positive way in your body, whereas the cyano isn't really a positive thing to have in your body. But that's the difference. Is these are questions you want to ask if somebody's doing B12 shots, if somebody's doing IVs. Okay, tell me about your products.
Quality.
Yeah,
Quality
what you're
versus
actually...
Are you using preservatives? That's the other question. We just had somebody come into our office the other day, and she had been doing IVs other places. And she's like, man, I just feel bad after I get these IVs. And she came into our place. She goes, I feel really good.
Yeah.
And I'm convinced it was because of preservatives that they were using. And so those are some good questions. And that's where the price tag, a lot of times, if it's really low, it's probably a lot of preservatives because it's really cheap to get stuff like that. And to make a preservative free is very difficult. And I get my products out of California, actually, from a company that, we go to our conferences, the anti-aging conference, some IV conferences, and these labs come in, and that's pretty much anybody doing really good work uses these labs. And there's more than one, but definitely it's very particular.
Well, that's where we asked, what your thoughts on organic versus non-organic foods were last time.
Oh, yeah, that was a good question.
Oh, yeah, it was.
Yeah.
Yeah.
Let's talk about that.
That's tough. My parents have a certified organic farm in Tennessee, and my mom's really anal, so she got this done, but it's hard. It's hard to get there, right? But to keep it is not as hard. And when they would go sell food at the farmers markets, everybody would buy their stuff first. They're like, it tastes better, and the irregular organic farmers tried to kick her out of these places.
Wow.
But what that emphasized to me, it shows how hard it is in order to do it right and to do it the proper way. But then you get state by state regulations as far as what's organic and what's not. And sometimes it's just a percentage. Oh, to be organic, you have to be a certain percentage to be called organic. And it's like,
organic honey.
What?
She had this.
Because it's true. To have organic honey, now I'm going to forget, but is it 12 or is it
like
30 mile radius?
Yeah, like
It has to be like it was like the bee can't leave. Like it was at least 30 miles.
And how do you know?
Exactly. Exactly.
Because there surely has been some.
Shirley. Don't call me Shirley.
There's surely
Let's tag it,
been
you
a
know?
scientist that knows how far a bee can go. I mean, I'm sure
thought
there's
it was
something.
I thought it was like 10 miles. Like that the bee could not leave 10 miles. It wasn't a ton of miles.
What
and
bee
so,
is going 10 miles? Like
How
he
do you
goes
know?
5 feet and he's hitting the
How
ground.
do you know?
Like
How do you
it's
know
not 10.
how
Here
far
we go.
can bees
Because they
fly?
Here we
think
go.
that
Let's
they
look it
think
up.
that that's wrong. That it is in fact contaminated honey.
I can't even
it
believe
is.
we're having this conversation.
Because it's a reality.
Yeah, right. I never thought it was going this way, but
lose
let's
my
just
mind.
say that's true, right? But how do you know your neighbor isn't just having some vegetables on the side of and they're using pesticides?
Because they can't be in the 30 miles.
But you have no idea, though. You have no idea. Like you could never say that. And I don't think these people are coming around and like testing other people's.
Then you're probably not buying the $22 organic honey because it's really expensive too. Organic honey is astronomical.
Well,
Like,
maybe they have a 50-mile radius of their own.
Yeah.
Maybe that's
Got
the
any
case.
facts?
It says they average around 2 miles from the hive, but it says there have been some known to have been observed foraging twice to 4 times that.
of how far?
2 miles. So
Yeah, see?
10
So
miles.
10 is
roughly, yeah.
good. We're good. But it
So,
does,
but that's if it's your average bee. Who knows if you don't have a go-getter that's like,
Right.
I want the flower over there on that hilltop.
we got the freaking froning bee that's like
you
taking an
never know.
80-mile
Ruin
hike.
the whole vat of honey.
Following
I
the
don't know if it would be
turkey.
a bat. I don't even know. what
A
it
vat.
is.
If it's not a vat, it should be.
Yeah, vat of honey.
So the point is though,
It's hard to be organic.
It's hard.
completely organic.
It is very difficult.
But it's better on your body because of
It is. It would be. Yes, it would be.
if you know 100%, then you're right.
You should at least try, no?
Well, yeah, true, but they also found this. They did some tests at supermarket food, right?
Poor Ellie.
Organic and non-organic, and sometimes the organic had more pesticides.
That's I don't buy
I'm
it.
out.
I gotta read the
I'm
study.
out. I'm done
no
for the
way.
rest of this podcast. I'll see you
headset
later.
drop.
I'm just saying.
No.
I would rather take my chances.
Look, okay, overall.
I'm not giving you attitude. I'm giving them attitude.
I know.
Just so
I
you know.
got it. No, oh, believe me. And I hear questions like this all the time. Like I know people that have organic restaurants, and they drive hours away to get the right stuff. But that's the key: is knowing where you're gonna get stuff. Like if my mom did it on a mass production, I would say go to her place and get this stuff.
Yeah.
By far, because I know her as a person, right?
Yeah.
And I know that she's gonna make sure
Right.
Well, and
everything's good.
It's like even as simple as like I always show them strawberries. Like you buy a conventional strawberry, you buy an organic strawberry. My uncle showed me this long ago.
I want the strawberry the size of an apple.
Yeah, a
Yeah,
little
that's-
red one with some dye
because
injected into it.
There's white in the middle, and it's not as good as the red one. Cut open an organic one and a conventional one. The conventional one's got white.
I want to be able
the
to hold
other
my
one,
strawberry like this. I don't want to do this.
Well, I will say the sweet ones are those smaller
Yeah,
ones.
small ones,
You know,
yeah,
I
that's
can't remember
true.
the name of
That's
them.
true.
I tell you, it
They're
goes
so
back
much
to the
better.
cows, though. We talked about this last time. If you put a cow in a pen and you put that feed that has all the pesticides on it, and then you put the
You mean,
organic
is
stuff.
it a cow with RBST or no?
Oh.
And you don't put a cow in a pen either. You put a pig in a pen,
What do you put a cow in?
a corral.
Really?
I don't know. I just made that up. I have no idea if that's right or not. I was just
Silver
trying to
with the
confuse you.
Is this like ethical farming or is this mass-produced farming?
What, the cow that'll come out of the...
I mean, because then the cow
Pen?
wouldn't be it would be in like a box.
Oh, gosh. Okay.
Are
no.
these free-range
No, we're
cows?
testing the cow. We're
Are
bringing
these
him...
grass-fed cows? It wouldn't be
Okay.
grass-fed because
No,
you're giving
we're-
them grain.
We're going to take him via leash to the testing location.
via
That's
leash.
Via leash. You gonna leash the
To
cow.
see you leash a
That
cow.
was awesome right there.
Actually, my cousins used to raise steer for 4-H, and they would walk their cows.
Yeah.
With a leash?
Every day they'd walk their cows, not with a leash, with a halter.
With a halter.
Halter and
Right.
a leash, I guess, would be attached.
Leash the cow though. That's
Leash
awesome.
the cow.
I'm just saying, he would pick the organic one every time, even if the food was outside the pen. The cow would ignore it in the corral, whatever it's
I don't know. I
called.
just made that up. Just trying to mess with you.
It would stick its head outside the pen to eat the organic.
Well, in that regard, you are right. The studies in the late 90s, early 2000s, now it wasn't geared toward organic. It was geared toward GMO food.
Oh.
And so then we get genetically modified organisms, and they would do studies where the animals would only go to the non-GMO food. And somehow all that research got put out like in some big journals, like getting all these stomach issues, testicle issues, cancers. and GMOs foods everywhere. It didn't even matter.
No,
So there's a bunch of money being made by claiming it's organic, and it's not necessarily organic. Is that fair?
That's a big question, yeah. Regulatory issues. Okay, you're right in the pure essence of organic farming or organicism, whatever you want to call it.
Organicism. That's a
if it's
great word.
but I like it.
You're right, but the question is it really? And that's what we don't know.
I don't know.
And like, there's a great organization though. Like this one I keep up with every time. If I see something important, I'll try to post it. It's the Center for Food Safety, and they keep up with all the bills and lobbying. And that way, like in Florida, they were trying to put antibiotics in our pears and our apples. And so we got enough people to sign up,
crazy.
and
So
they got
bad.
it cut out and made sure that didn't happen. But that was only there. I don't know about anywhere else. So, it's keeping up with stuff like that to really just share it and try to make people aware of what could happen.
You can drive to their farm and get your stuff.
I'm going to do it. That's what I'm going to
It's
do.
only in Knoxville.
I was watching
go.
that show that Adam Ruins Everything the other day.
Yeah. Oh.
And he was talking about medical and how the healthcare system, and he was just talking about how antibiotics are basically going to ruin
They're
modern
so
medicine.
bad.
Right.
100%. Yep. And
Because everything's building up resistance to it, and
Right.
doctors just prescribe them because they're just like, we'll see.
well, and that gets into the other stuff I do. We talked about the nutrient IVs I do, but I do ozone blood therapy, I do ultraviolet blood therapy, and this actually can go in there and kill toxins and build up your immune system.
Well, we're talking about that. You're a DO, not an MD.
Correct.
Kind of
Yep.
explain the difference.
So a DO is a doctor of osteopathy, and nowadays in all 50 states, and medical doctor of osteopathy, we have the same licensing, we do the same schooling, and we have the same rights to practice as physicians and surgeons and everything. And even the family practice residencies are the same thing nowadays.
Okay.
They went under one board instead of being under different aspects, and that just happened, I believe it was last year.
Oh, okay.
So nowadays, it's the same stuff. I will say we do get hands-on training in our DO schools, and that's what led me into what I did. So I am thankful for that. So once a week for 2 years, we have to go in there and look at people's bodies, look at the ribs, feel the tissue, and then some of us, I'd say 5 to 10% actually go and do what I did. I did a fellowship in it, extra year, where I, go in to see a patient for an hour, then the doctor comes in and goes, "You were wrong on everything. Okay, let me show you the right thing to do."
Yeah.
Oh, wow.
And so, but it was just that one-on-one training. Here, this is how you do it. And then we learned different techniques. We learned the hard techniques like cracking and popping. And then we learned soft techniques like craniosacral and the fascial techniques, which are the most difficult because you have to have really fine touch. And then I trained as my third year at a hospital where we did that manipulation as an inpatient. So if you had surgery and other issues, we would actually do it in select cases to help improve the lymphatic system, help the body heal faster, get you out of the hospital faster. We'd also do it as outpatient, obviously lots of pain, and some disease states as well. And then I would follow a lot of private guys around, and that's how I got good at what I do with my hands.
Nice.
The flu epidemic in the early 1900s, that it wiped out a lot of people. The people that did see a DO, they work on a lot of lymphatic and saved a lot more people than if you went to a traditional doctor, just give medicines. Because it's all about making the body heal itself.
Yeah.
And if we can get your lymphatic system moving better, that way it just gets rid of the toxins. And we really believe that a lot of things just get stuck.
Right.
And stagnation, as I'm sure you're all aware, stagnation in anything in life
It's not good.
is not good.
That's in Chinese medicine too, right?
Exactly.
Like,
And I you bring up a good point too. I ended up doing the UCLA School for Doctors too, for acupuncture. And so I studied that philosophy for a while. And, for me, it was putting these different philosophies together. Medicine, I saw what happens when people are in the hospital and go down that road and, training with orthos and other places. But then the manipulation, I was able to see how people got better. Acupuncture, I was able to see that. I got into the stem cell, PRP, the prolotherapy injections, and was able to see their results. So for me, it was just putting all these things together and coming up with that philosophy and idea of how the body functions.
Right.
Because too many people, they come at it from one direction, but there's 10 others they're missing out on. So,
What are some of the most common toxins and their causes that you deal with?
I tell you, a study came out, ended in 2013. It was a 10-year study, and it was primarily done at Mount Sinai Hospital in Miami with the cardiologists, and it was done throughout the whole country with the chelation experts as well. But they would look at lead levels and heart issues. And the study was called Trial to Assess Chelation Therapy. And as people get older, especially women, we find that lead, if it's high, it has a tendency to give heart attacks and cause heart problems. And so they wanted to find out, well, if we do chelation on these people, how effective is it when we look at our traditional therapies, medication or doing nothing? And, the conclusion was basically it's as good as our medication therapy.
Chelation.
Chelation is the removal of the metals.
Okay.
Sorry about that.
No, it's okay.
Yep.
I was like, am I the only idiot that doesn't know what chelation is?
Good call.
Probably.
So the downside to it, is a 40 treatment process, right? But then you think about, okay, go in for an IV 40 times, to get all the lead out, or take a medicine the rest of your life, or 2 or 3 medicines. So because that study did so well, the NIH has sponsored another study, $48 million, to study chelation and diabetic neuropathy, which is when your extremities, they get numb, they get tingly. And so we look at it as a circulation problem. And guys I trained with, I saw lots of people with those circulation issues. It got a lot better and felt a lot better. So I look at it as remove toxins, get your body functioning better, and have a better quality of life down the road. So get back to kind of your other points too, is really I see a lot of gut issues because I do think the hormones we've been talking about, the GMOs just ruin our gut. And so I really go high dose probiotics. I love to do things that are healing the stomach, healing the intestines, and then attack it from the inside with our IV therapies, ultraviolet blood therapy, ozone blood therapy, the vitamins, because maybe the gut can't get rid of those infections or that what we call leaky gut syndrome on its own. We have to get it from the blood from inward instead. And I find much better results when I do that together with it. Then oxidative stress, if you have no glutathione, your body's not going to be functioning very well at all. And, it's been very interesting to see people that have had these IVs all throughout the world, and they move to Miami, and they come in, they already know, like, hey, I need glutathione. I need it once a month. Or my patients teach me a lot as far as what they've been through. I went to 20 doctors. It wasn't worth it,
Yeah.
So now this is what worked. There was a doc, he works in an ICU, right? And in the ICU, that's the sickest of the sick, right? Because usually lots of medical issues, different things happening. And sometimes they get sepsis, the patients. And sepsis is a severe infection in the body, inside the blood, which a lot of times does kill people. So, I don't know the exact percentage on how many people actually get out of it. It's not great. So this one doctor is like, well, let me start doing IV vitamin C. And his patients got better. And so now there's a big argument out there. Well, you didn't do it in a double placebo-controlled study, and so therefore we don't really know if it's real. And he's like, but I do it and they get better. And so there's this little argument out there if it should be used in hospitals. This one hospital is using it now, but others aren't. And so then the thought process goes, okay, obviously if you're sick, come in, we'll do vitamin C, help get you better. But why not be doing it before?
Yeah, right.
Why not try to prevent these things from happening? And that's where I really come into play. I treat a lot of young athletes. I've treated very sick and very young athletes and very young people in general that are just trying to be healthy. And the people that do this on a regular basis, they usually don't get sick as much. They usually feel better. And everyone around them that's not doing it,
wants to do
they
it.
Notice it. Like these guys will come in and they'll be like, well, my wife and kids are sick and I'm doing okay. And it's like that never would have happened before. Yeah. So it's all about building immunity, building your body back up. And us, why do we age, right? We age because of toxins, and we lose our nutrients, and our bodies can't divide anymore. Our chromosomes, our telomeres, which we don't have to get into all that today, but that kind of stuff gets affected, and we just need to put these things back in our body to make it work again.
So speaking of like toxins and things like that, I heard, can we talk about testosterone for a second? I heard something the other day that said someone born in the early 1900s, when they reached the age 70, they had the same amount of testosterone as someone who's 30 to 40 years old now. And they were saying most of that, or what they think that is from, is things like the parabens and like body lotions and shampoo and stuff. I'm going to butcher this word, but I brought it up to you guys once before. Binding coagulin or or something locks onto that and keeps your testosterone from freely flowing. So saying nowadays a 30-year-old has the same amount as a 70-year-old that was born in the 1900s. I mean,
so how do we fix that?
Exactly. Like our
You're not talking about sex hormone binding globulin, are you?
is that it? Is that how I say it?
It
Yeah, I
could
think
be.
so.
If it's synthetic.
Yeah, it says
see.
well, I don't know if I spelled it right, but it says it's contributes to less free-flowing testosterone because that binds
Okay.
to it for whatever reason.
That was a
Not
long
quite,
question,
not
Ellie.
quite
It was.
No, but
Well, you bring up a great point. You know, I go to these conferences, and obviously the docs range in age from 20 something to 90 something, right? And this one guy goes, "Well, when I was younger, the testosterone levels we saw on blood tests were twice as high, and we've cut them down." For what reason?
yeah,
Because everybody else doesn't have that testosterone anymore. Now, I can't say for sure if he's right or not, but I could kind of believe it. So
Scary.
yeah.
well, they think it has to do with, from what I heard, and I could be wrong. This is just something I heard. Like the parabens that are found in shampoo. Well, everything we use has that, and if that is put into your body, then that's supposed to bind up that testosterone.
Yep, and also there's a great book to read, Anti-Estrogenic Diet. If you look in our foods, the plastics, everything, they stimulate estrogen.
Mm-hmm.
And if you stimulate estrogen, your testosterone is going to go down. So that definitely plays a role with that.
What's the keys to that diet?
Yeah. I tell you, read this book. It's
What's it called again?
the anti-estrogenic diet. You'll be so surprised
down.
how much is actually in your body.
Yeah.
And it kind of goes back into my practice. It's not I'm going to make you better with one thing.
Yeah.
It's I want to stimulate your body to be healthy
Right.
by getting rid of toxins. And these
Right.
microparticles, even these parabens.
Well, that was the whole point of that question was,
Yep.
do your treatments alleviate the parabens that all of us are exposed to so much on a daily basis, which would technically improve our performance if you freed up that testosterone?
Exactly.
It's on its way.
I can't
It's already
say.
ordered?
Yeah.
Wow.
Amazon. Amazon.com.
Jeez.
Boom.
Awesome.
So the next interview, that'll be a topic.
There we go. I got to refresh my. I haven't read that book in 6 years. So I can't say 100% because we never test everything.
Right.
But like EDTA, the main chemical I use for getting rid of the metals, it was also used back in the day before we had antivenoms for spider bites
wow.
and for snake bites. It was used before that and actually would get rid of toxins. So one time I got bit on the foot and had cellulitis, and
Got
I
bit
was
by
like,
what?
I was playing softball. I'm sorry, not softball, volleyball, and I think it was a spider bite.
Oh, I was thinking like a snake. I was like, that's awesome.
No.
Snake.
I'll tell you a good story about that. Somebody I trained with, though. But yeah, so all day my foot was hurting the next day. I'm like, what on earth? I looked at it. It was huge and red. And, typical treatment, take antibiotics and this stuff, right? I was like, you know what? If I'm going to be doing this kind of medicine, I got to try it out. So
Sure enough.
So I don't have a foot anymore.
so I did the EDTA. I did vitamins with vitamin C, and then I put some oils on my foot. And 3 days later, it was gone
Wow.
completely. No antibiotics, nothing. And I was like, okay, this stuff works.
Way to risk it for
This stuff works.
study.
Well, I'll
peg
tell you
leg.
that I had a little bit of a background though, because the guy I trained with on this, his son, when he was 10 years old, got bit by a coral snake,
Oh, wow.
Ooh.
and he's in the middle of nowhere. He can't get somewhere, and so he calls and like, okay, if we airlift him over here, he'll probably be dead. So he's like, what do you have? He's like, I have EDTA. He's like, well, that's what we used to use, and he put him on an EDTA drip the whole night. And he went in and out of seizures all night, but within 24 hours he was fine.
Wow.
And he
crazy.
never had another problem.
Wow.
So, that's what kind of gave me a little.
Wow.
I didn't get bit by a coral snake, so I was like,
Aren't you supposed to chop the head off or something and take it to the doctor? Or does my dad just lie to me? Like if
I
you're
feel
bit
like
by a
your
snake.
dad lied to you a lot.
No,
Wow.
he said
Yes.
in law school one time he was fishing with a buddy. He calls the buddy a big sissy because he'd never been fishing or something. That's probably irrelevant. Anyway, he gets bit by a snake. He tells his friend to look the other way, and he grabs the snake and he chops the head off because if it was poisonous, if you don't have the head of the snake, then you die. No? I don't know. Anti-venom? Eh?
I can't say I've heard that before.
Yeah, I've never heard that before.
You're not supposed to capture it? Just in case?
Well, oh, no, you would capture it so they can see what kind of
You want to
snake
know
it
what
is.
kind of snake it is,
it's
so
not
they
that
can
it
give you
contains
the
a cure.
correct.
Yep.
That's
Anti-venom.
right. Okay, sorry about that. Quick tangent.
Like around here, it could be a rattlesnake or a copperhead or something else.
The fact that he survived a coral snake, though, that's
It was pretty
incredible.
impressive.
It's
Yeah.
crazy.
Yeah. So that guy, he was kind of one of my biggest mentors as far as just, hey, we're going to treat anything and fix it, naturally. I was like, all right, that's cool stuff.
Yeah, that's really neat. What did you learn about oil the other day? We were talking about the difference between olive oil and grapeseed oil, and that's...
Oh, I didn't look it up. I just took Josh Bridges' word for it.
Oh,
Apparently, they're saying that grapeseed oil is better for high temperature, high heat cooking because olive oil, apparently, there's some new study out that says something happens to olive oil when it gets hot and turns into a carcinogen.
That's bad
I don't
news.
know. So we've been
Not
using
cool.
grapeseed oil to cook in it.
You actually changed?
I don't know. Josh left it at the house on Tuesday.
Go figure. Coconut oil, too.
what are some of your thoughts like on anti-aging specifically?
So my
Why,
thought,
Jim?
Huh?
Why?
Because I'm old.
Because you're old?
how young do you want to be?
Man, I want to go back to, let's see, go back to 26.
You called Doc Brown?
Yeah,
That DeLorean out front?
absolutely.
So my thought on that is, again, it's really just toxins.
Yeah.
And so, I kind of got into it on a side note in the sense of I was treating sick people. And then let's say we do IVs or we do treatments like for 3 or 4 months, right? They started looking better and they looked younger.
Yeah.
I was like, man, what if we do this on just a regular healthy person? So do it. Actually, I was really my first subject again. Anything I do.
I
Why
like that.
not?
I like it. That's cool.
Anything I'll do,
Oh, yeah, you do those.
yeah. I was wondering what they were looking at. I was like, what are you talking about? I look like a monkey. No, so 10 years ago, approximately, is when I got into IV therapies. And I was doing them 3 to 4 times a week for a whole year. And I look younger now than I did then.
Really?
No doubt. Easily. Way younger. I was getting gray hair, went away. Now, if we wait too long to try to treat something, we usually can't do it, so we have to get things early. The other things...
You're too old.
Is that what we're saying? Is that what it is?
It was there. He teed it up. I had to use it. Sorry.
Got 1 foot in the grave.
Sorry, Jim.
So,
I'm going down swinging.
So we got to work on the internal aspect, right?
Right.
Because if we have toxins in our body, and then we just got to get them out, and we got to get nutrients back in our body. Genetics does play a factor, but most of the studies and most people believe now we're 80% our environment and 20% genetics.
Yeah.
So we have to have some pretty significant genetic issues to create a big issue. And then there's outside factors, doing injections, PRP, stem cells for the face, the hair.
Right.
Now the big craze is doing it for the penis and doing it for the vagina. And oddly
I don't know
enough,
about that.
yeah, most of my patients like to go out for that one.
Yeah.
Yeah.
But it does work. It does work. And as a side effect, especially with women, with something called interstitial cystitis, which is a very bad bladder infection that can be very difficult to get rid of. Some people are even doing catheters with stem cells in there. But doing the PRP around the areas is seeing some interstitial cystitis go away. Even incontinence is seen go away in women too. And those were all side effects. We were, people doing this were just trying to make people feel good. And then all of a sudden these things got better. So, we're seeing some different things come along, and it's just a matter of, okay, what do we need to do to really to facilitate that? But internally, get rid of toxins, boost your immune system, get nutrients back in your body. Outside, stimulate growth of your skin. We regrow the collagen, regrow hair follicles, and increase blood flow. At the end of the day, blood flow is the key.
Yeah.
Having the right things in your body with increased blood flow is gonna really help. And again, testing like this, we do this for performance. So I kind of came up with a test that I can look at for performance, for illness, for anti-aging. These are the things, if they're in your body, they're going to keep you from getting your goal.
Are there any suggestions that you give to people so you work so hard with them to clear all these things out and do the IVs and stuff, and then they walk out the doors? Do you suggest, hey, go find someone to get some coaching on not putting this in your body? Do you give them specific, just so that they don't end up back at square one again after they work so hard to clean everything out.
100%, you're right. There's a lady I work with down in Miami who's she's a vegan chef, and so she was used to buying this for the restaurants on how to buy really clean food. But it is kind of localized because she knows the stores in Miami. There are some online stores you can get very clean stuff from. And so if people are willing to, I want them to talk to her. She comes up with a weekly meal plan and that you can use as a basis to make your body healthy. I haven't found anybody in Tennessee at this point. I think it could carry over, and it's not like she would have to be, right in front of you. You could talk on the phone, and we like to do a food sensitivity test in that case too, because we want to know if there's some foods that are reacting in your body. Okay, we know you shouldn't be eating those. It creates inflammation. You may think that blueberries are great for you, but in your body, it may not be. Yeah, so I like to do those kind of testings too. And if we're really going to get in the diet, the food part of it, because we really need to know that information.
Is this the main test?
To me, if I only had one test, this would be it.
Right.
Because I just have so much information about this, about the gut, about oxidative stress markers.
And it was called
the Genova Nutrival. So yeah, we have the citric acid cycle. We have our gut testing. We have our toxin detox markers. We have
this one.
Let's see the last one here.
Did you guys know that grass-fed beef has more omega-3s and vitamin E than non-grass-fed beef?
What's grass-fed beef?
Cows that eat grass.
Is it grass finished, or is it grass
finished? What does that have to do with anything?
Because what they do is they can call it grass-fed beef, but they grain finish it.
What does that mean?
Put some fat on it when they get it to
No.
the. Yep. Yeah, that's what you got to start looking at.
Great.
You look into. I'm surprised you didn't know that.
That's that whole percentage thing that he's talking about with organic food.
When are you getting your
this
cows?
Hmm?
When are you getting your cows?
You got to put fences up first.
Sorry, back to the original point.
Well, no, it's a great point though, because
It's the whole organic
terminology and everything makes a difference, and unfortunately, people they don't always like to tell us the truth.
Because you grass feed them, so they've been grass fed, but then they grain finish them to make them a little fatter the last couple months or whatever before they go off to slaughter.
Or free range, they let them out for 5 minutes. Oh, they're free range. Okay.
Well, yeah, I mean, you start looking at that. I sent you that thing
the
about eggs, where
that
basically,
was horrible.
if it says vegetarian fed diet on eggs, you can basically say they're not really free range, not like completely free range, because if they're completely free range, you can't control their diet, so they're gonna eat some insects and some stuff like that.
And it was controlling. Like, he sent this list, and it showed the difference between, like, not grass-fed.
Cage-free was
and how
one,
much
free
space
range, and then whatever.
So I took it to the grocery store, and sure enough, based on, like, the 2 different words on each one, and you saw the price go, like, I mean, it was crazy, but it was all really true, and it was just from, like, a word or 2.
Billings, right. Matt Billings, a friend of Rich's, was breaking down, it takes double the time to get a cow to wait by just feeding it the grass than it does by finishing it, and how do you make money and all that whole thing.
Mm-hmm.
It's traumatizing.
Yeah, it's like the hormones in the chickens. 60 days, they're pretty big chickens, but they can't walk on their legs because they didn't grow right.
Right.
That's really sad.
No, it's bad. Yeah, so like this test has even a lot of nutrients in it. As you can see, there's all kinds of stuff in here. But thing is, a lot of people analyze to the depth on this, but man, wear yourself out. So I look at the things that are actually going to make the body recover and get this back to baseline, which is the gut toxins and oxidative stress markers. So that's why I like this test the most. And then, there's obviously doing the regular blood tests, looking at your CBC, your hemoglobin, red blood cells, your white blood cells, looking at your kidneys, your liver, making sure those are working right, making sure your thyroid and adrenals are working. Get a hormone panel just to make sure they're in a good level, a range. And then looking at insulin and cholesterol and different things like that, just to make sure we have our good baseline so we're not hurting ourselves. And then usually it's the mitochondrial, the metabolic things that are creating abnormalities within our regular blood work. And that's where medicine will be moving. And it already has. A lot more people are doing this stuff than they used to.
So if you were to walk in and you wanted a full pan, how many tests is that?
So blood tests covering everything we just talked about: kidneys, liver, blood, adrenal, thyroid, cholesterol. Then we got to do this test, which is a mixture of urine and blood, and then 2 urine tests to evaluate the metals in the body. And if we do the food sensitivity testing, it's a blood test to do that as well. And sometimes insurance covers part of this, sometimes it doesn't. So that's where it gets a little tricky.
Right.
And a lot more things we can do, just depending on symptoms. If we're doing it, okay, for health, or are we trying to find a problem? And then we can go even more in depth with that. So
how do we sign up for these things, and how do people find you in the event that they would like to try these things? So
first is to do a consultation, and we'll just see what you're coming in for. And then based on that, ideally, would love to get this stuff done before I even see you. That way we have the information and we can talk about everything. If the complaint you're coming with is a little more complicated, it's better that I see you first and we can do other things. But then just call in the office, either in Knoxville, which is 865-321-1732, Miami, 305-367, what is the other number?
I was about to be impressed that you even knew phone numbers.
I was like, I don't even know my phone number.
Oh my
wait,
gosh.
I got it. It's 305-367-1176. Or visit our website, www.theosteocenter.com, and we have sample reports of these things, so you can take a look at what we'll actually be doing.
We'll
have
these. Dre flash some of these up
Yeah,
too
we'll get it up there.
on the
It's
while
really
we're
interesting. You
talking about
guys
it.
should see these papers. They're cool.
And I'm trying to do much.
We're not going to show them to you.
No.
Go to the website.
And I'm trying to do more and more video testimonials. Like you were there, that lady.
Yeah.
That was one of the best
Yeah,
ones.
talk about that one. That one was pretty cool.
Oh man, yeah. This lady came in severe pain she retired early from her job. She had too much pain. She got diagnosed with something called lupus, which is an autoimmune issue where you actually see markers in the body elevate. And so for 5 years, she was living like this. She had doctor after doctor, and she just gave up. But one of my patients said, no, you have to go see this doctor. And she's like, okay, one more shot, that's it. And did 10 treatments on her, and she's feeling better, going out with her friends, went back to her rheumatologist, and her levels have actually come down to almost normal, which
crazy. Yeah, my grandma had lupus. And
so
they think that's what led to her having heart attack and passed away. So yeah, it's kind of crazy.
Well, it creates a lot of inflammation in the body.
Yeah.
And we really believe autoimmune issues are gut related. The body's cross-reacting, creating antibodies. And if we can just help the immune system function better, we can help it.
That's cool.
Yeah, that's awesome.
Definitely.
Is that an hour?
1 hour. Boom.
1 hour.
1 hour, 2 minutes, 10 seconds.
Dang.
Awesome.
Woo!
Cool.
Great.
We'll have you
Thank
back.
Thank you. Appreciate it.
Yeah, no, that was a good one.
Yeah,
ProNingandFriends.com. Check us out. OsteopathicCenter.com.
Osteopathic Center. The OsteoCenter.com, but Osteopathic Center.
Cool.
I couldn't get the whole name. It was
Internets.
already taken.
Awesome.
Cool.